our results also call for institutions and stakeholders to take action, really. There is no one solution. It's plenty of solutions that have to be taken together and to change things and provoke an increase in quality of life at work, basically.
Welcome to EHA Unplugged, the official podcast channel of the European Hematology Association, EHA. I'm your host, Isabel Olivera, and today we have the pleasure to have with us Dr. Côme Bommier. Dr. Côme Bommier is a clinical hematologist at Hôpital Saint-Louis in Paris. Thank you for being with us today.
Thank you for inviting me.
Dr. Côme Bommier is also an associate editor for the Journal of Ethics and Medicine in Public Health.
Correct.
And he is recognized for his work on bridging clinical practice and ethical reflection. So he has been involved lately in a burnout survey conducted by Young EHA and the Young National Society ambassadors. This burnout survey was directed to hematologists. So in this podcast, we're going to talk about how this burnout survey came about, why was it designed, why was it done, and we were going to have an insight into the observations of this survey. So first of all, can you explain to us how did this burnout survey begin?
Burnout is not a new problem, and we all faced difficulties in our daily life of practitioners, of physicians, but this is a problem that was not addressed in hematology. So 2 years ago, I was a Young National Society ambassador for France, and together with the Young EHA Committee, we decided to speak louder about that matter. And so we decided to set up a webinar to raise awareness about burnout with two key figures, two key personalities in the burnout research. First was Tate Shanafelt, former Mayo Clinic physician now in Stanford, who has been working on burnout for 2 decades at least, and Elie Azoulay, who is intensivist in France and who has also been working in the burnout research for 2 decades as well, but more in the intensivist part of medicine. While Tate Shanafelt is an oncologist, so he has been working a lot in oncology. And so we made that webinar like a year ago. And right after the webinar, we set up a questionnaire to run a survey that was conducted between September and October of 2024. Thanks to the support of EHA and with the help of Membership Matters, so a society that was associated with EHA. And very luckily, I mean, we were very happy to see that in less than a week, there were already like 1,000 respondents taking the survey. And so we let the survey run a little more, a few weeks more. And at the end of the day, we ended up with a little less than 2,000 people responding to the survey. And the results are striking.
Mm. Were there any particular circumstances or incidents that made you get interested in burnout?
We all face challenges in the daily practice. All the healthcare systems are in tension. It's not only in France, it's like in all Europe, even in the US. And generally from Europe, I used to have that feeling that, in the US, they have a different healthcare system. So, well, it might be less fair. When you're in the system, it might be a bit better in terms of quality of life at work. But then I realized that it was not the case. They had other issues, and the burnout is rife also in the US. And based on the studies conducted in oncology by Tate Shanafelt and his colleagues, 45% of the respondents of the oncologists showed symptoms of high burnout. So this is something very important.
What are those symptoms? That was my next question. How do you recognize burnout? And also, how were they assessed in the survey? Did you assess burnout in the survey?
So burnout, as it says, you feel burned out. So it's consuming you from the inside. And as you might guess, we cannot see every respondent on a psychological interview and assess the exact level of burnout in each person. So we use a validated questionnaire that is called the Maslach Burnout Index, and that relies on 3 components. The first one is emotional exhaustion. The second one is depersonalization, cynicism, and the third one is personal accomplishment. And so if you have a high emotional exhaustion or a high depersonalization score, you present symptoms of burnout, high severe burnout. And aside, there is the personal accomplishment component, and so it's a different score, and it assesses if you have a low personal accomplishment in your work.
And so, what are the consequences or risks of burnout? There are personal consequences, but there are also consequences for your colleagues and for the institution, for the patients, obviously.
So something that is not well known is that burnout is an epidemic. It's like COVID. It's if you have 1 or 2 or 3 colleagues that are burned out in your department, you're more likely to declare burnout yourself. Okay. But then, of course, it's not only that aspect, because if your colleagues are in burnout, it means that there might be systemic factors explaining or triggering that burnout. So there are many factors. So in the surveys that are conducted, we're not able to draw a straight causality between the factors and the burnout, but we draw association, it's statistical inference. And based on all the data that is already published in the literature, there are factors that are recurrent. I mean, if you don't read that literature, you will think that it's very personal, that people are not well organized. They feel overwhelmed by the tasks they are assigned. Maybe they're too young, not mature enough. But what the literature says is that overall, the burnout risk is 80% associated with systemic factors, 20% associated with personal factors. But of course, people want to correct the personal factors because this is on what they can act and play. And so we always speak about resilience, and people try to have a better work-life balance to better cope with the situation. But what we also underline with our survey, but which correlates with what was already observed in the literature, is that the systemic factors are really, really important. The importance of management, of support, of hours, of course, workload are very, very important, and really drag the physician towards burnout or not.
Can you tell us what have you observed in this survey?
So yeah, the main results that are like very striking. I wasn't expecting that really. Mm-hmm. So the burnout definition is high emotional exhaustion and or high depersonalization. And so you have 43% of the respondents that had high emotional exhaustion, and a third who had high depersonalization. Oh. And so when you aggregate these results, 50% of the respondents declare having symptoms of burnout. Whereas we're all working, right? People are working, are seeing patients every day, and half of them are in burnout. And moreover, in addition, like 2/3 of the respondents have a low personal accomplishment. So they engage into these long medical studies. They wanted to help others. They decided to become hematologists. Most of them are cure cancer. They are facing death on a daily basis. They really want to help the patient they're seeing every day, and they are not accomplished in what they do. And half of them are like very tired and or depersonalized, which is scaring at some point. Our results also call for institutions and stakeholders to take action, really. There is no one solution. It's plenty of solutions that have to be taken together and to change things and provoke an increase in quality of life at work, basically. So far, it's very observational, but hopefully in the future, it will be a little more political in terms of discussion within the institution, with EHA to start, and with the national societies, and with the hospital locally, to change the work conditions and to make it livable for the physicians.
So it is really great that you are raising awareness about this problem. So what advice would you give? Is there something that you have learned in this journey that could help?
So this is a very personal question. And as I'm not a psychologist, I don't know if my advice is a good one. But what I can say from the observation I've done conducting this survey is that being young, being female, being a woman, being not having a senior position or not having an academic position or a tenured position is associated with higher burnout rates. So we're living in a very high-pressure field with the confrontation of death on a daily basis. Lots of responsibilities, lots of demands from the patients, from the institutions as well. And so I think the hardest years are, of course, between 25 and maybe 40 years of age. We cannot accept the idea of a tunnel that we all have to go through and finally light comes. We have to open that tunnel and make it different for other younger physicians. This survey is only like a one-time survey. It's not a longitudinal assessment of the burnout. We're not able to say whether people grow out of burnout when they grow older or if they leave the specialty. The advice is that, there's no advice. You have to take care of yourself. We all have one life. We're looking after the other's life, but we also have one life. And there are every year suicides among physicians that happen, and among young physicians mostly. So this is something very serious and concerning. And so we have to take care of ourselves, for sure. And we have to find a meaning in what we do. One of the key drivers of resilience in occupational health is having a meaning in what you do. When you see patients and when you treat them, you find a meaning in that because you have an input in their lives. And when you, at the end of the year, you will remember what you've done throughout the year, and you will say, okay, I've been very helpful for this person, and that patient came to thank me and gave me a little present. So it means that I'm useful. I was useful to him or to her, and which makes sense to my commitment. Okay, but pay attention to keep this sense of meaning, because if you lose it, it means that you might be in burnout and you're in danger. So keep that in mind. We all can be very exhausted, fatigued by the intense rhythm, pace that we have in a daily life. But if you have a very strong meaning in what you do, and if you keep your empathy, if you're able to act humanly with humanity, with the patient and with your colleagues, if you still have the impression to act positively towards them, then you're preserved a little bit from burnout and you'll be safer. But if you don't find that meaning anymore, and if you feel more careless towards the others, then it means that you might pay attention.
If a member of our audience wanted to participate in these efforts of raising awareness and then also for institutions, is it possible? How would they get involved?
I think everyone can be involved. We had an initiative, and I hope that EHA will foster research in the field by maybe supporting a longitudinal assessment and assessing maybe targeted intervention, maybe EHA, the national societies and the local institution. We all have to develop targeted intervention mainly towards young people and women because they are more prone to develop burnout because of systemic factors, okay? The gender disparity is something very important. It's not only as regard to burnout, it's a very systemic issue, but as regards to burnout, it has to be addressed as well. For example, the flexibility of the schedule at work, the career for women, because due to pregnancies, it might stop and start again, stop and start again. And it's more difficult for them to get access to senior academic positions initially because they are not 100% of the year at work, you see. And so, there are many interventions that can be done. You don't have to work in the intensive care unit, like throughout the year. You might, for example, in acute myeloid leukemia or aggressive lymphoma unit, you might work 2 months and then switch to the outpatient clinic and then come back to the intensive unit. Because if you are only confronting the hardest cases and the hardest human situations throughout the year, it can really consume you.
So if you want our audience to remember just one thing from this podcast, what would be the most important thing?
It's not easy. If there was one thing to remember, it's not only the first-line physicians that are exposed to burnout, the senior are also exposed to burnout, the laboratory workers are also exposed to burnout, the researchers are also exposed to burnout. So this is a problem that is rife in the profession, and we should really take action collectively to make that change.
So thank you very much, Dr. Bommier, for being with us today. And thank you for all of you for listening, and stay tuned for more episodes.